Hello everyone. Today I want to discuss something about AV fistula. AV fistula in relation to chronic renal diseases or CKD as we commonly call it. So what is essentially an AV fistula? Now if you or your loved ones are diagnosed with chronic renal failure, your nephrologist is very likely to suggest you to get done an AV fistula. So AV fistula is something, it's a surgical procedure wherein we anastomose the artery and the vein, and that is used for dialysis. That is an easier way of dialysis rather than putting a intraluminal catheter through the neck or through the groin. AV fistula is an easier way, so it is done for chronic renal failure. Now, how is it done? AV fistulas are commonly done under local anesthesia. It is done at the wrist level. That particular area where we are going to do the surgery is anesthetized using local anesthesia, and the surgery is performed. It takes approximately around 1 to 1.5 hours to perform that surgery. So you should be aware that during that time frame you should be able to lie down on your back with your arm sort of stretched sideways so that the surgeon can do that particular surgery. Now, why this is important is because if you have dyspnea, if you have difficulty in breathing because of the renal failure, it is better to get yourself dialyzed before the actual surgery is being performed so that the surgery can be done smoothly. Now, what medications do you need to take before surgery? If the surgery is being performed under local anesthesia, then you need to take all the medications of diabetes, hypertension, and all the systemic illnesses which have been prescribed to you by your physician. If not, if the surgery is being performed under regional anesthesia or general anesthesia, you need to consult with your plastic surgeon as to whether you need to take those medicines with sips of water or you are to go totally nil by mouth for that particular surgery. So you better check with your plastic surgeon before going for the surgery. Now, what about dialysis before the actual surgery and after surgery? Now, what happens during dialysis is that the blood pressure of the patient tends to go down after dialysis. So, we don't recommend dialysis immediately after the AV fistula surgery is being done, because what happens is since the blood pressure goes down, the flow between the artery to the vein that also comes down, and the chances of fistula failing increases. So, that is why dialysis is not recommended immediately post surgery. Same thing is true for immediately before surgery. So you need to time the dialysis in consultation with your nephrologist as well as your plastic surgeon. I'm talking specifically related to the surgery part of it. Now, how many days after the AV fistula can you dialyze through the fistula? It takes around 4 to 6 weeks for the fistula to mature. What happens is that blood flows through the artery into the veins. You need to do some exercises post-operatively, and over a period of 4 to 6 weeks it matures enough so that that particular fistula can be used for dialysis. Again, before using that fistula for dialysis, you need to consult with your plastic surgeon and your nephrologist. They might advise you sort of a Doppler to know the flow rates through the fistula and to check whether that fistula is ripe enough for the dialysis to be done through the fistula. Now, what precautions do you need to take post-operatively? A couple of very important things. You need to keep the limb elevated. Now, whichever the extremities where the surgery is performed, whether right or left, you need to keep it elevated. If you are sleeping, you need to keep it like this or on some pillows. Then you need not take your hand below your head or under some pressure, so that also increases the chance of fistula failure because of compression. And the most important thing is you need to start doing exercises. Now, we have smiley balls or a sort of grip strengtheners which you can use so that more blood is pumped from the artery into the vein, and because of pumping of this more blood from the artery into the vein, the fistula matures rapidly and you are able to use it earlier. Now, how to know if the fistula is working or not? So, if you feel the fistula, the operated site, you will feel some thrill over your fingers. So, that is a clinical indication that your fistula is working. Now, suppose it happens that you go home or after a couple of days you realize that you don't have any thrill over your fingers when you touch that operated site, then you please consult your plastic surgeon. If a thrill which is already there is disappearing, then it might need a relook at that. It might need some investigations and some intervention to check if the fistula is working or not, and if not, to take some remedial measures. Then we also need to understand that there are certain scenarios when doing a fistula is not possible in a particular patient. Now, decision regarding fistulas is done based on the sort of lumens, the diameters of the peripheral veins. So if that particular vein is of a very low caliber, it is very thinned out, we possibly can't do a AV fistula. We need to go higher up to the elbow level. If the wrist level is wrist level veins are not appropriate, we need to go at a higher level and do the fistula there. Even if that is not possible, then there is something called perm cath, or it is also called as permacath, which is a catheter which is inserted through the neckline and it forms a conduit for dialysis. So these things are also necessary for us as patients to know. One more important thing which I missed out earlier is that if you have been diagnosed with CRF and your nephrologist has advised you to get done an AV fistula, right from that particular day, you should stop avoiding any pricks, any injections through the extremity from where the AV fistula is being planned. Now, generally the AV fistula is planned on the non-dominant extremity. If you are a right-handed person, we prefer to operate AV fistula on the left hand. So see to it that the entire left hand is not pricked, no blood, no samples are taken through that extremity, because what happens is that when the veins get pricked, the chances of post-operative problems in that particular extremity increases. So no needle pricks for that particular extremity. What are the other complications of AV fistula that you should be aware of? Now, AV fistula means artery and vein are joined together. So what happens is that the hand, that particular extremity can get swollen in the post-operative period. So that is one of the major complications. Another complication is that the fistula might fail. Now, fistula failure, the global rates, if we see, of fistula failure are almost to the tune of 20% or probably even more. That is for primary fistula failures. By primary fistula failures, I mean that the fistula fails to work itself, or if it is working, then the flow rates are not enough to perform the dialysis through that fistula. So either ways, the fistula is not useful in those cases. It might be because of various causes, various systemic problems because of the renal failure, the quality of the arteries, veins, and multiple reasons which might lead to fistula failure. So in those cases, either we need to change the location and give it another try, or we need to go for a perm cath insertion depending upon the local conditions and in consultation with your plastic surgeon. How long after the surgery are the sutures removed? I would say around two weeks or so, maybe around 12 to 14 days. If the healing is uneventful, we tend to remove the sutures of AV fistula surgery. So I think those were some of the important points regarding AV fistula which I wanted to stress upon. Renal failure is a very deadly disease and it takes a toll on the patients as well as the families. So take care, guys. Cheers.